Hello and welcome to Maro's YouTube training series on issues of occupational health and safety. Our topic today is bloodborne pathogens. We'll talk a little bit about the MIOSHA standard, its background, and the parts of its enforcement that are relevant to community rehabilitation organizations. Provide you with a few definitions from the rule. Talk a little bit about the diseases that bloodborne pathogens can cause. Some of the risky situations both at work and in the community, and most importantly how to protect yourself. And that is the most important thing you can walk away with from this training, is a sense of confidence with regard to how you protect yourself. The MIOSHA regulation has been in effect in Michigan since 1993. These things take a while to discuss and enact and become regulations. And so that takes us back to the late 80s and early 90s, when there was still a lot of fear and anxiety and even hysteria about AIDS. When it became clear that HIV is the virus that causes AIDS, and that HIV, in addition to being sexually transmitted, can be a bloodborne disease, then there were folks who deal in that media at work all day, every day, like healthcare workers, who had a legitimate concern. And that's the target working population, and in fact the target workplace environment that the regulation was crafted for. But there is a broader scope of coverage, a broader umbrella of coverage that's provided by this regulation that does affect community rehabilitation organizations. And we'll try to make that clear as we go on this afternoon. The language that you see on the screen now is from the regulation itself, which defines an employer's responsibility, and it basically says that if you provide a job to someone in Michigan and anything about it presents the risk of exposure to blood or body fluids, then the employer has to do something about it. They have an obligation to educate employees about that risk and also provide them with the tools and materials that they would need to protect themselves. Two definitions from the rule. A pathogen, in plain language, is simply something that can make you sick. It's a disease-causing agent, a virus or a bacteria. Bloodborne means that that disease-causing agent can be transmitted or carried through human blood. So when we discuss bloodborne pathogens, we're talking about something that can make you sick, that can be present. It isn't always present, but can be present in someone else's blood. But it can only infect another individual. It can only cause a problem or transmit illness if we come into contact with that blood in very certain specific ways. And those are the risky situations that I referenced a few moments ago that we'll define as we move along. The three most common diseases that are covered under this regulation are HIV, the human immunodeficiency virus, which causes AIDS, and two strains of hepatitis, hepatitis B and hepatitis C. All potentially very serious in their own right, all very different, and really included in the rule for different reasons, which again we'll cover as we move along. Another term that's used in the standard is other potentially infectious material. And that means that in addition to blood, there are other body fluids that can transmit those three illnesses. And they include the body fluids that are associated with sexual activity, the fluids that surround the brain, spine, heart, and lungs, any fluid that's visibly contaminated with blood, and certainly when we can't tell whether or not blood is present, then we should treat it as though it is infectious. And even if we include some of those items that are more relevant to a healthcare worker, it's a pretty short list and doesn't include some other stuff that you just might come into contact with through the course of the workday or even out in the community. Things like saliva or sputum, getting coughed on, getting sneezed on, or even getting spit on. It can happen, and it's gross. It can make you sick. You can catch a cold, catch the flu, and in fact there are other even more serious illnesses, the pathogens for which can travel through that media, through the air carried in saliva. But that is not the case with HIV or hepatitis B or C. And this is as graphic as I'll get with you here, so forgive me in advance, but urine, feces, and vomit are all certainly full of all kinds of nasty germs and bacteria. And if you ever have to interact with a person where any of that stuff is present, whether providing personal care, cleaning restrooms, or assisting an individual who's sick to their stomach, you should protect yourself in the same ways that we'll discuss in a few moments when dealing with blood. That's just good infection control practice. But behind that, it's important to know the facts, which are, unless blood is visibly present, These are not capable of transmitting HIV or hepatitis B or C, and the same is true of sweat and tears. In terms of the risky situations that affect a workplace like a community rehab organization, it can be broken down into three fairly broad categories. The first is contact with non-intact skin. By non-intact, I mean that the skin is both unprotected and broken. The most obvious example of that would be a first aid provider coming to the assistance of an injured consumer or colleague. And if that injured individual were cut and blood were present, if the first aid provider jumped in and put pressure on that wound directly with their bare hands, and on their hands they were nicked up a little bit, they had a cut or a sore or a scratch, then that's an exposure. No barrier layer of protection like a pair of gloves would provide. And in addition to that, the skin that touches the blood is broken or not intact. The second category of risk is through contact with what are called mucous membranes, which is a fancy term for eyes, nose, or mouth. If you work in a hospital or a healthcare facility, the biggest risk for that type of exposure is splash. But for the rest of us, it's more likely to occur through accidental or unintended secondary contact. So if, for example, after treating an injury or perhaps cleaning up after an accident, I have put my gloves on to make sure that I provide that effective barrier layer of protection so that I don't come into contact with that potentially infectious material. But if before I'm finished, I forget about what I'm doing and I have itchy eyes or runny nose, or it happens to be during the month of November and I do one of these, I put myself at as much risk as if I never put the gloves on. So it's important for us to remember, and certainly to communicate to any employees or consumers who might be doing a job with gloved hands, is that when those gloves are on, we need to stay away from the face to avoid facial contact, because that can be a way in for the stuff that's potentially harmful that might make us sick. The third category of risk is through contact with a sharp contaminated object. A needle stick is the most obvious example of that, and most workplace exposures occur in a healthcare environment when employees make a mistake when handling a needle after administering a vaccine or perhaps drawing blood. That not being the case for most of us, it's not as big a risk, but it can happen in other ways as well. Certainly needles are occasionally disposed of inappropriately and can be found in the trash or in donated goods. Cuts from contaminated sharp objects can occur in other ways as well. Broken glass, a pair of scissors, a razor knife. Again, anything that's sharp enough to pierce skin that has someone else's blood on it could cause a problem. So those are the three fairly broad categories of risk. If we get a little bit more specific, and rules tend to do that, there's a list at the end of the regulation, an appendix, that lists out a series of job titles or categories to whom or to which this rule very definitely applies. And that includes healthcare personnel, the professions that you would expect right away, like doctors and nurses and EMTs and dentists and so forth. It also includes first aid providers and CPR providers, which includes many of you. Certification in first aid and CPR is a part of our secondary job responsibilities for many community rehabilitation organization staff. And it doesn't really matter if you are in the shop or in a school or out in the community. If you are coming to someone's assistance, if they're injured or ill, then this rule definitely comes into play, and you need to know how to protect yourself. This appendix also includes some professions that you might not expect at first pass, like barbers and beauticians, cops and correctional officers, even plumbers and tattooists. And it's certainly not important to memorize a list, but it's important to recognize that there can be a broader scope of situations that might present a risk beyond the traditional healthcare setting. And it's important to understand what those are in advance so that we can be prepared and protect ourselves accordingly. It's kind of the heart and soul of the matter, as it is with many things that have to do with workplace health and safety. If you understand how and where something bad might happen, then you prepare so that it either doesn't happen and we can avoid the problem, or if there is an issue, that we can come to someone's assistance or correct that problem both safely and quickly. In terms of the risky situations that can occur in the community, as they're non-work related, Most transmissions of HIV and Hep B and Hep C occur either through unprotected sexual contact with an infected partner, sharing drug, tattoo, or piercing needles, and in fact the sharing of personal items that might have blood on them, like a razor or a toothbrush, should also be avoided. A couple of at-risk categories that really are not covered by the MIOSHA standard but simply good public health information is that transmission can occur from an infected mother to her baby during the childbirth process if the woman was dealing with one of these illnesses as a health status prior to or during pregnancy. And folks who received donated blood, like transfusion, should talk to a doctor about that if it occurred prior to July of 1992, because the blood supply wasn't screened for hepatitis C until that date. It certainly is now, but prior to July of 1992, for folks who fall into that category, they should consult a healthcare professional. Appearing on the screen now are a series of misconceptions that most of us have moved beyond. The kind of casual contact that we can expect to encounter, whether it's in the workplace or out in the community, will not routinely present a risk of exposure. The primary job categories that present that risk include first aid and CPR providers, those who are involved with janitorial or custodial responsibilities, particularly if they're cleaning restrooms, and anyone involved in personal care or assistance of another individual. If you are going to help someone if they're injured or ill at work, that's when the risk of exposure can arise. Some of the signs and symptoms for these three diseases include, with HIV, onset is usually accompanied by rapid, unexplained weight loss, chronic fatigue, night sweats, and a person becomes prone to certain types of infection, like sinus infections, because their immune system isn't working as well anymore. Hepatitis symptoms tend to be flu-like in nature: abdominal pain, nausea, vomiting, fever. The Hep B symptoms are usually more severe. A person feels sicker, but in most cases they recover and quite often develop an immunity to the disease after the experience. And with hepatitis C, it's almost the opposite, that the symptoms are either very mild or they don't present at all, so that a person quite often doesn't know that they're infected because they don't feel sick. But on the other side of that, there's a much higher rate of long-term complications and chronic infection. In fact, an 85% chronic infection rate for hepatitis C. In the longer term, therefore, hepatitis C may present the greater concern. Another reason for that is that there is preventive medicine for hepatitis B. There is a vaccine, a series of 3 shots that are administered over the course of 6 months that have been proven to be very safe, very effective, and very long-lasting, which in public health is kind of a win-win-win. The serum was introduced in 1982. Since that time, there's been a dramatic reduction in new cases of hepatitis B. The Center for Disease Control now basically recommends the shots for everyone. They're on the U.S. Health Services immunization chart recommended for infants from birth through the first 6 months. And the latest, they're also required here in Michigan for school-age children, and that's been the case since I believe of 1999. And the most recent long-term study indicates that the immune memory stays in our system, or the level of immunity that's granted by the vaccine series, is for 23 years or longer. So the CDC now says in print that a booster is neither recommended nor required. As it relates to this regulation, if a person is at risk of exposure to blood as part of their primary job duties, they must be offered these shots by their employer at no charge. An employee certainly does not have to accept. If they decline, then that should be documented in writing. And if that employee initially declines but later changes their mind, these shots should be offered at that time. It's also important to note that regardless of your job category, if you ever get someone else's blood on your skin at work, that it should be reported right away. It will be thoroughly screened to determine whether or not it is an exposure incident. And if that is the case, that person would be offered medical treatment. And if they haven't had the shots yet, then they would be offered again at that time, because there is some benefit to administering the vaccine even post-exposure, because there is quite a long incubation period for hepatitis B, a matter of weeks. And in fact, there's some immune benefit that's granted by the very first shot in the vaccine series to kind of beat the virus to the punch. Okay, having talked a little bit about the regulation itself and some of the situations that can put a person at risk and the diseases that are covered under this rule, we'll conclude by talking about how you protect yourself. And the main method for protection is more of a mindset or an attitude that's called universal precautions. Precautions means be careful, and universal means all the time. It's really an assumption that all blood and body fluids are infected. You behave as if the stuff is going to make you sick, and then protect yourself accordingly before you get involved so that you don't get sick. And for some of us, that before you get involved part can present a kind of conflict of conscience. What would I do, for example, if I were working next to an individual who cut themselves? I know how to help them because I have first aid training, but if the kit that I needed with the protective gear and treatment supplies were all the way over on the other side of a very large building, what would I then do? Well, if that were a test question, it's kind of a trick question, because if the multiple choice answers were A, jump in and assist the individual and put me at risk, that's not okay, and neither would it be acceptable for me to let my friend and colleague bleed here while I went and chased down the stuff that I need for treatment and protection. So it's none of the above, and in fact you can't regulate a person's conscience. You can't tell them how they must react in a situation like that, but that's not the point of this rule. The point of the regulation is to create an obligation for employers to recognize or anticipate where a situation like that might occur, and then equip employees with both the tools and materials that they would need, as well as educating them about the risk, so that they never have to make the choice between helping someone safely and helping them quickly, which is why in most community rehabilitation organizations there is an ample supply of first aid kits with both treatment supplies and protective gear so that they're readily available. In plain language, what universal precautions means is that if you do what it takes so that the stuff that might make you sick doesn't get in you, doesn't get in your system, and doesn't get on you, doesn't get on your skin, then you'll stay healthy regardless of where that material came from. Sometimes to practice these universal precautions, we require the use of personal protective equipment, and single-use gloves are the most important item. They're available in latex, an alternate form of rubber called nitrile rubber, or a vinyl glove. All are equally acceptable and provide a suitable barrier for protection. In addition to that, if you're trained and authorized to administer CPR, then a mask should be available to you, preferably equipped with a couple of extra features. A one-way valve on the mouthpiece that the provider touches so that air can only travel in one direction, and then a barrier filter on the part of the mask that covers the mouth and nose of the recipient, so that there's 2 extra layers of protection from contact with body fluids. In addition to that, the equipment that's more associated with a medical facility, eye protection, surgical masks, gowns, perhaps even coverings for head or feet. It's a good idea to have a set of that material on site, but it's certainly not required for every response. For example, if you need to bandage a small cut, wipe up a small spot of blood, or perhaps put pressure on a bloody nose. And if you dress for surgery to do that, you'll probably freak somebody out and needlessly alarm a person who needs your help. We don't want to make light of the fact that there are occasions when that material would be appropriate to use, but for most minor incident responses, a pair of gloves will be acceptable. After treatment of an injury or cleaning up after an accident, the gloves, as I mentioned, are single-use or disposable, which means they should be removed immediately after use. And the technique that we use to do that is important, because if they're not handled carefully, we can end up again actually exposing ourselves and putting ourselves at as much risk as if the gloves were never put on. When the first glove is removed, we should pinch it from the outside, pull it out a little bit, and then peel it back. I don't touch bare skin with that gloved hand. When the glove is removed, I can either make one nice neat package of both gloves, or if that's uncomfortable for you or the individual that you're teaching this technique to, that can certainly be thrown away. With the second glove, we need to do things a little bit differently, though, because now I have a bare hand and I don't want to touch the outside of this glove. Instead, sliding a finger up underneath, pulling it out a little bit, and then pinching it, but from the inside. And as I slowly pull that back, then I've never made contact with the outside of either glove. And the next thing I do immediately upon removal is wash hands at a sink with soap and water. If other items in addition to gloves become contaminated, they should also be turned inside out and disposed of. If If clothing gets contaminated, it should be washed separately in a bleach and water solution. That's what will kill the germs. And any hands are exposed to skin should be washed immediately after contact at a sink with soap and water. It's still the most effective method for disinfection. If a sink with soap and water is not readily available, the hand sanitizers or waterless disinfectants that are widely available are effective germ killers, as are alcohol wipes. They're both specifically mentioned in the regulation, but again, a sink with soap and water and a good scrub, front and back and in between, is still the best method for protection. If you're involved in cleaning up after an incident where blood's present, certainly the protective equipment is important, and we've covered what might be relevant to use there. In addition, there are certain materials that should be used to make sure that the surface is properly disinfected, and these include either an EPA registered disinfectant, which means it will say on the label, this kills the germs that cause, or it might say this is germicidal against, and it'll list them out, HIV, HBV, and perhaps several others. If that's not available, a mix of bleach and water is acceptable. It should be mixed in a ratio of 1 part bleach to 10 parts water. And if you ever have to pick up sharp objects that are contaminated with blood, please never use your hands for that, not even gloved hands, but use tools like a broom and a dustpan or a pair of tongs. If items become contaminated with blood to the point where they're soaked or saturated, it can become regulated waste, which means it can't go into the trash. Items that are soaked or saturated should go into a red bag that has a biohazard symbol, as you see on the screen. Those items that are sharp, used needles or other sharp objects that can't be safely decontaminated, need to go into a sharps container, which again you see on the screen and you may have seen in a physician's office. The red bags are for objects that again are soaked or saturated. A Band-Aid or a gauze pad with a small spot of dried blood or perhaps a tissue does not need to become regulated waste. It should be wrapped in something else that's absorbent, like another tissue or paper towel, and then placed into a leak-proof bag, preferably one that can be sealed, like a Ziploc plastic bag, and then it's safe to throw away in the trash. And that's not me saying it's okay to take shortcuts. That comes straight from MIOSHA. Regulated waste is absorbent materials that become soaked or saturated with blood. Lastly, there's a document that you should know about. It's called an exposure control plan. And most community rehabilitation organizations have developed a policy regarding bloodborne pathogens or bloodborne infectious diseases that meets the terms of this requirement under the regulation. In it, you'll find an exposure determination or a list of the job categories of folks who are at risk, the control methods for their protection, which we've covered, universal precautions, hand washing facilities, personal protective equipment, and potentially waste disposal. And the Hepatitis B Vaccine policy will be stated there. Also, you'll find a description there of the post-exposure evaluation process, which we haven't covered. The most important piece of that is immediate reporting. If you ever get someone else's blood on you, it should be reported right away. Again, thoroughly screened to determine whether or not it is an exposure incident under the terms of this rule, and if so, that person, that exposed employee, would be offered medical treatment. And it's important that that take place right away, because if the healthcare professional determines that treatment is what should happen next, the treatment options are not as effective if they're not started within just a few hours after the exposure. So not at the end of the week, not even at the end of the shift, but right away is when an incident like that should be reported to make sure that folks get good care. There is training required under this regulation, initial training prior to an employee's assignment to the job task that might put them at risk. And then there is an annual refresher requirement as well. And there are very strict record-keeping requirements under the terms of this regulation, both for medical records, employee training, and a separate log for injuries involving sharps. If you have any questions about this regulation or any of the material that we've covered here today, feel free to contact me. My information is now on the screen. Or any issues at all regarding workplace health and safety at your organization, please don't hesitate to get in touch with me. Also on the screen is contact information for MIOSHA, which provides a wealth of resources on issues of occupational health and safety, not just on bloodborne infectious diseases, but on many subjects relevant to keeping employees safe and healthy. And be careful out there.